Hi, hello guys, welcome to Renis Nursing Academy, Nagarkoil. Hope you all are doing good, staying safe. So, இன்னோட கிளாஸ்க்கு போறதுக்கு முன்னாடி நம்ம சேனலை subscribe பண்ணாதவங்க subscribe பண்ணிக்கோங்க, பக்கத்துல இருக்க bell icon-ஐ click பண்ணிக்கோங்க. So that when I'm uploading my next videos, உங்களுக்கு automatic-ஆ notification-ல show ஆயிடும். Class எது பத்தி அப்படினா it's for an NCLEX review, the class regarding Crohn's disease. So இந்த disease வந்து we will see in gastrointestinal system. So here we go. So this is about, as I told you, Crohn's disease. Yes. So Crohn's disease, this is one of a disease condition that will be coming under inflammatory bowel disease. Yeah. So the other name for Crohn's disease is also inflammatory bowel disease. Yes. As the name indicates, there will be some inflammation that is occurring in the bowel. As a result, we are developing this particular condition. So next, enga idu varudhu appdin pathina, usually we can see this on the terminal portion of the ileum or the beginning of the colon. So this is the main place where this Crohn's disease usually will occur. But generally pathina, it can occur any place on the GI system, whether it may be small intestine or large intestine, it can occur anywhere. But the important portion what they had given is on the terminal ileum or the beginning of the colon. Yes. So coming to risk factors. So the risk factors is about 30 years old people and the people belongs to Eastern European descent. Then the people having smoking habit, and finally this is very important. It is one of the main cause that people using NSAIDs, that is non-steroidal anti-inflammatory drugs, and also it can be risk for patient with some genetic abnormalities. Here an important thing is not the clear-cut cause was given for Crohn's disease, so that's why I just listed down all the risk factors for Crohn's disease. Then next one is about the symptom. So symptom, the important symptom what you can see is due to malabsorption syndrome, the patient will develop diarrhea all the time. So that is the main symptoms what you can found out in Crohn's disease. Then other symptoms, I was given in an acronym Christmas. So the first letter indicates the symptoms that I had been given here. So C stands for cobblestoning. So that means normally in the Crohn's disease, inside there you can see some scattered tissues you can see. So it looks like a cobblestoning. So it was indicating cobblestoning. Then high temperature, they have increased temperature. Then reduced weight or appetite. The patient will not have that much appetite. So automatically they will reduce too much of weight. Then intestinal fistula you can see. And stool for blood. So when you are observing the stool, there you can find out some blood there. Then T for transmural. There is so deep involvement of the colon will be there. That is why it was given transmural involvement. Then M stands for malabsorption. I told you already in the beginning. Then A for abdominal pain and S for strictures. Yeah. So these are all the important symptoms what you can see in this particular Crohn's disease. The next one is about the diagnosis. In the symptoms itself, I told you, you can find out blood in the stool. Yes. So they go for stool for occult blood. So if there is positive stool for occult blood, they go for the next level investigations like colonoscopy so that they can confirm this Crohn's disease. Yeah. So they go for colonoscopy. So in this colonoscopy, they will ask you questions like what position you can give during this particular procedure. So the position is Sims lateral you can put. And another important complication followed by colonoscopy is intestinal perforation. So by doing colonoscopy, they can develop complication also. Then finally, you can go for CT, MRI. For looking at the structure of the colon, you can go for CT and MRI. So these are all the common diagnostic evaluations given for this Crohn's disease. Here an important thing is when stool occult blood is positive, they go for colonoscopy to confirm Crohn's disease. Then now we are gonna see about management. The management is a brief topic that will come under this Crohn's disease. Here we go. First let me start with the common medical management. Then I go for the beyond our brief management, what we can do for this Crohn's disease. First, let me start with the common management. So first you have to start with the complete GA assessment. Always keep in mind when the question is like for any disease condition, if the word given assessment in the option, you have to go for the option assessment only. We already know in the nursing process itself, the first thing what we will do is always assessment. So here also same, for the patient with Crohn's disease, complete GA assessment should be done. That is the priority management that was given. And the next thing is you have to tell your patient to stop smoking. In the risk itself, I told you, people who are having the habit of smoking, they are high risk for developing Crohn's disease. So you have to give education regarding smoking cessation. The next thing is about IO chart monitoring. The complete intake output chart you have to monitor properly. And next important thing is about weight monitoring. As the patient having decreased appetite, the patient can lose weight for a to extent thing. So you have to have a weight monitoring regularly. The next important thing is for assess for infection. The patient might have developed fever, chills or anything. That is due to, I already told you, inside there may be some scattered tissues will occur. Inside some inflammation will be there. So as a result of inflammation, the patient will be having infection. So you have to look for the symptoms of infection. Then the next thing about monitor dehydration. So dehydration symptoms like increased concentration of the urine, increased concentration of the urine. Due to that, the patient will be having dry mucous membrane, dry coated tongue, sunken eyes will be having. No, so you already know what are all the symptoms for dehydration. So all the dehydration symptoms you have to check. As we already know, the main symptom here is about diarrhea. So once the patient is having diarrhea, there will be loss of water in the body. So you have to look for the dehydration symptoms. Then the next thing is about ostomy care. Why ostomy care had been given here is that for some patients with this Crohn's disease, they will undergo ostomy. So for that particular patients, you have to give common ostomy care, what we will do for the normal ostomy patients, whether it may be ileostomy or colostomy, how to give abrupt ostomy care. Now we see about the brief management here. There are two therapies, that is, one is about medication therapy and another one is about nutrition therapy. So here for the patient with Crohn's disease, when you are combinedly giving all these two therapies like medication therapy as well as nutrition therapy, the thing will be very, very effective. So first let me start with the medication therapy. There they are starting the medication called corticosteroids, example dexamethasone, prednisolone they are using. So steroids you have to use for this anti-inflammatory function. The next thing is about immunosuppressive drugs. So immunosuppressive drugs, it will act on the immune system. So they will start on immunosuppressive drugs. So example methotrexate we can take. This is the most common popular drug. They have been used for immunosuppressive drugs. So they can start on methotrexate. The next one is for antibiotics. So antibiotics will help to reduce the infection rate in the body. Then analgesics you can give for the abdominal pain, and make sure about it, in analgesics you have to avoid NSAID for pain. So don't take NSAIDs, because I already mentioned in the risk factors, people who are taking NSAIDs can develop Crohn's disease. So avoid taking NSAIDs. So you have to take a normal analgesics. Then next thing is about probiotics. This is for malnourishment. The next thing is you can supplement vitamin therapy, iron supplement and all you can replace. Then final one is antidiarrheal medications you can start on, and the patient will be having malabsorption syndrome. As a result, the patient will develop diarrhea. So you can start on antidiarrheal medications also. So these are all the things that will come under medication therapy. So all the things you have to combinedly start for the patient with Crohn's disease. Now the next important thing is about the nutrition. Then coming to nutrition, you have to particularly focus on elementary diet. So elementary diet you already know about it. It may be comes in powder form or liquid form. You can go for elementary diet. Then TPN you can start for short term use, like when the patient is on hospitalization you can go for TPN. The next thing is, this is very, very important, no dairy products for the patients with Crohn's disease. Example, milk, butter, cheese or anything. All the milk and milk related products, all the dairy products you have to completely avoid, as it acts as a triggering factor for them. Then the next important triggering factors is about caffeine. So caffeine including chocolates, coffee, everything, and also all the spicy foods you have to avoid for the patient with Crohn's disease. Then the next thing is about they have to always go for small meals. Avoid large meals all the time. So always go for small meals at a time. Then they can take increased amount of water. This will help to compromise this dehydration. Then they can add fruits, vegetables in their diet so that this malnourishment can be controlled. Then the next important thing is, this is also very, very important. Always go for low fiber diet or low residue diet as the patient is having diarrhea. So you don't go for high fiber diet. So this is very, very important. So follow all these instructions that was given in the nutrition therapy. So always for Crohn's disease, always the therapy, that is medication therapy and nutrition therapy, has to be given combinedly for the good results in the treatment. Then finally, about the complication. The complication they can develop is about fistula, fissures they can develop, abscess they can develop, strictures, and finally the patient may end up with malnourishment. So these are all the common complications that will occur for this patient with Crohn's disease. So these are all the contents regarding Crohn's disease. This will be very helpful for the patient who are going to write your NCLEX RN exam. So this is a complete NCLEX review regarding Crohn's disease. Hope this video will be very useful to you all, and I will see you soon in my next upcoming classes. Stay safe. Thank you so much.